Over the past few weeks, a disturbing trend has emerged in Kerala. The state now accounts for around 50% of all COVID cases, daily COVID cases in India. Some days it's more than 50%, a little more than 50%. The positivity rate is very high. And so while in the rest of the country, the second wave is ebbing, in Kerala, the second wave is continuing to be strong. There are worries that this is actually not the second wave, but the beginning of a possible third wave, and we'll come to that in a bit. The question many people are asking is what's happening in the state, because at the end of the day, Kerala was a state that touted its ability to manage the pandemic. So what is happening? And you'll have to look at it in multiple dimensions. One dimension is really the dimension of science and macro health parameters. If you look at it from that perspective, according to the latest serological survey that was conducted by ICMR, and a serological survey is nothing but a test for antibodies, a blood test for antibodies to see whether the larger population has had an exposure to the coronavirus disease. It's very bad in terms of diagnosis, but it's very good to understand larger epidemiological picture of what is there in the state. Shows that Kerala has the least seroprevalence, which means most people in Kerala have not been exposed to the virus, and as a result, you are beginning to see infections there. That's one theory. Is this plausible? Definitely, because if your immunity is low, you will begin to see a lot of cases. In Delhi, for instance, which was not covered in the serological survey, but where we believe that a huge proportion of the population has been exposed to the virus, you're beginning to see very, very few cases. And you know, the fall off from the peak of the second wave in Delhi was very significant, because at the peak of the second wave, almost anyone and everyone in Delhi had COVID, right? All of us knew people who had COVID. I mean, I had COVID during the second wave. It pretty much didn't spare anyone. Some of us got off lightly, many didn't, unfortunately. And I think you're seeing a little bit of that in Kerala. It's also evident in the fact that the gap that you have between the number of cases that you should get with a certain level of immunity and the daily reported cases is narrowest in Kerala. Let me just explain this. If a certain proportion of your population has been exposed to the virus, it would mean that when you conduct tests, you get a number which is close to that proportion as your positivity rate. If you don't, it means that either the infections are old or you're not testing smartly enough. In Kerala's case, this gap is the narrowest gap among all states in India, which means either their testing is very high, which in some ways is true, because if you look at their tests per million, which is a good way of comparing across states, Kerala's tests per million are quite high. They are higher than most major states in India. They are higher than most states which have a population in excess of 10 million in this country. So, which is a pretty good comparison to look at. So, high level of testing and the narrow gap between the positivity rate as well as the rate of exposure that you get from the serological survey could well explain scientifically and theoretically why Kerala is seeing a surge in cases. There is another theory as well, which is also equally plausible, on why Kerala is seeing a surge in cases. While the state government insists that its restrictions have always been adequate, and that many people in the state have shown a high level of discipline in maintaining that, anecdotal evidence has told us from the beginning that the discipline is pretty much as bad as it is everywhere else in India. Masking is patchy, social distancing happens sometimes it doesn't happen. There are events that happen. And if you look at what has happened in recent days, Sabarimala for instance, and also the fact that the state actually removed restrictions so that people could celebrate Bakrid. All of these resulted in people moving around, meeting other people, gatherings of the sort that normally should not be allowed during COVID actually happening to some extent. And to my mind, that too contributed to what we are seeing in Kerala. So, it's not, I don't think they can account for the entirety of daily cases that you are seeing. I don't think they can account for the high intensity that you are seeing right now, but they are definitely a contributing part. And so, you have one bit of contribution coming from the fact that Kerala doesn't have very high exposure to the virus. So, if infections are there, they will be there. But then you have another bit of contribution coming from the fact that, the state government itself has been lax. Now, of course, they have a weekend curfew this weekend, I think, so which is good. In fact, I think Kerala probably needs a lockdown, because the one thing we know for sure will work is a lockdown. But that's something we'll come to in a bit, because I think there are larger messages that need to be taken from what is happening in Kerala. I think we need to do things that we didn't do during the second wave. The first thing that we should really do is sequence enough viral genomes, because I definitely like to know, and I'm sure a lot of people definitely not want to know, but I think they need to know whether this is being caused by the Delta variant, whether this is being caused by Delta plus, whether there is an entirely new variant that is causing. So, I think you should have blanket viral genome sequencing happening in Kerala right now. It's probably the most critical thing that should be done. The center, it's fine. I mean, I know the center is saying we are sending a health team and all that. I think the most important thing that the Union Health Ministry can really do is to make sure that enough viral genomes from Kerala are sequenced, because we have to find out what is causing this surge. If it is the original Wuhan strain of the virus, if it is Delta, fine. But for each one of these, you will have to be prepared in a certain way, because Delta we know is more transmissible. And looking at the surge in cases, one would think that it is Delta. But at the same time, if you look at the hospital situation in Kerala, they still have beds. So, the capacity has not been exhausted. The healthcare system is not getting overwhelmed the way Delhi's healthcare system got overwhelmed during the second wave. April, what we saw in Delhi, when all of us got panicky calls from people who were looking for oxygen, who were looking for medicines, who were looking for hospitals and not finding any, right? I mean, no beds to be had. You're not in that situation yet. I hope we never get to that situation in Kerala. I hope we never get to that situation in any state. ICU beds, again not fully occupied. Oxygen, still no real shortage of oxygen. So, the other parameters seem to indicate that right now, whatever the infection is being caused by, it's still not resulted in the healthcare system getting overwhelmed. But that's no reason to get complacent, right? I mean, you need to make sure that that whatever is happening there is contained, which probably means that Kerala needs a hard lockdown. Kerala probably needs to look at movement of people within and outside the state, just to ensure that the infection that's there in Kerala, this surge that is there in Kerala doesn't get transmitted to Karnataka, doesn't move on to Tamil Nadu, because that's how typically things spread. And simultaneously, you need to sequence enough viral genomes, you need to find out what's happening. But I would take heart from the fact that the healthcare system has not got overwhelmed. I would take heart from the fact that if you look at per million vaccinations, I think Kerala is right up there among the top 2 or 3 or 4 in this country in terms of per million vaccination of the eligible population group, which is great. I mean, what is not so great is that the India number itself is not very healthy. So, I would be happy if the number is 60-70%. We are nowhere close to that. But Kerala is up there with the best in the country, which is good, which means it's not lagging in the vaccination drive. If it is the Delta variant, and most of the people in India are getting Covishield, we know that it doesn't give you full protection with just one dose. One dose gives you 33%. I mean, one dose is 33% effective in preventing an infection. 2 doses, it goes up close to 60%. So, I'm hoping that there is an effort to really push vaccinations in Kerala. If I were to do 2 things that would really take care of what's happening in Kerala, or three things. The first one, I think which they're already doing, they're testing adequately. If possible to expand, I think we should just expand testing even more. Maybe even test almost everyone in the state if you can, right? Lockdown. I think it's very important that Kerala places a lockdown. The third thing, which is more from the science point of view, sequence more viral genomes and maybe make an exception for Kerala in terms of shrinking the gap between two doses. So in 4 weeks, they get 2 doses of Covishield, will really help get this thing under control.